Good afternoon, and thank you for joining us today. We are hosting this virtual forum to discuss the coronavirus, also known as COVID-19. First, I'd like to send my condolences out to all in New Jersey, in the U.S., and across the world who've lost loved ones during this crisis. I'd also like to share my deepest sympathies and prayers to those who are still fighting the virus. Today, we're here to discuss the Trump administration's response or lack of the COVID-19 pandemic and lessons from our country's fight against the Ebola virus. These lessons can help our country respond to the challenges that COVID-19 possesses. Additionally, today, the discussion will highlight some of the steps the Trump administration should be taking to help state and local governments reopen America safely, along with a comprehensive plan for testing and tracing. Federal government needs to provide support to families on the front line, workers, and across this nation. I have with me here today my colleague from Homeland Security Committee, Representative Max Rose, representing New York and being an active member in the National Guard. Representative Rose is no stranger to disasters. I would also like to welcome our panelists for today, Mr. Ron Klain. Mr. Klain served as White House Ebola Response Coordinator from 2014 to 2015 and was instrumental in standing up the Pandemic Prevention and Response Office during the Obama administration. Mr. Klain appeared before this subcommittee in March at a hearing on this topic. It's good to have the opportunity to talk to him again today, since that time when we were first planning for this outbreak. Thank you for being here, Mr. Klain. Now I'd like to recognize Representative Rose for any brief opening remarks he would like to give.
Yeah, Mr. Payne, thank you so much for your leadership. Mr. Klain, thank you for your service to this country and for taking the time out of your day to be here with us. And of course, I'd like to just take a moment to acknowledge and pay respect to the incredibly deep suffering that my community is enduring right now. New York City is enduring, New York State, Mr. Payne's home state, New Jersey, and of course, the entire country. I truly do believe that this is a monumental moment that is equivalent to total war and requires us to not only appropriate and allocate and distribute necessary resources and really mobilize all of society, the private sector and the public, but it is also a moment for us to learn lessons of the past, see what lessons learned from previous instances of us facing a crisis like this, or an issue, obviously not of this size, but nonetheless a similar issue. But I would like to just close out by saying this. I have little to no interest in us using this moment for politics, for us using this moment for unnecessary finger pointing. The purpose of this, from my perspective, is very simple. What do we have to do to prevent this from ever happening again? And two, what do we have to do to ease suffering as much as possible, as well as safely and responsibly open up this economy? So with that, Mr. Klain, I again thank you for being here, and I'm excited to hear your thoughts.
Thank you, Representative Rose. So, Mr. Klain, with that, I think we'd like to jump right into the questions. Since you've appeared before the committee in March, has your perspective on the federal response changed? And do you have additional guidance for Congress now?
Oh, thank you, Chairman Payne, for that question. Thank you, Congressman Rose, for being here, for the opportunity to share my thoughts with you. I mean, we're here. It's the first day of May. We just ended one of the most tragic months in American history. I think we're going to remember April 2020, sadly, for a very, very long time. We lost 57,000 Americans in that month alone. It's more than we lost in the entirety of the Vietnam War. It's a 9/11 event every other day for an entire month. And I just think the pain and the suffering and the loss is going to be with us for a long time. To pick up on something Congressman Rose said, I think we need to ask hard questions, not in the exercise of finger pointing and looking backward, but because what we're doing now still isn't working. Talking about what's wrong with the response is not necessarily about allocating blame for what went wrong in the past, but trying to fix what's still going on wrong right now. And I think that falls into a couple of key areas to answer your question, Mr. Chairman. First of all, we still aren't testing anywhere near the number of people we need to be testing. I raised this when I testified before the subcommittee in March, and at that time, we had been promised there would be tens of millions of tests by the end of that month. It's now almost 2 full months later, and what we're seeing is still tests in the 200 to 300,000 a day range, not the 500,000 to 1 million range that we need to be at. So our testing situation is still broken. That's point one. Point two, we still have not fixed the problem that, again, I testified to in March about a lack of protective gear, face shields, masks, gloves. Now we need that gear, as we did back then, to protect our healthcare workers and our first responders and the people like Congressman Rose himself who are out there serving in the National Guard and other things. Those people need that protective gear. But most importantly, or more importantly, I should say, what's changed since March 10th is, as we talk about now reopening the economy, more and more American workers are going to need that protective gear too, to go back to their jobs safely, to interact with the public in shops or restaurants or other places. And so that gap that was there in March, remains in April, is still a giant gap in May. And in some way, as we get back towards more activity, will become a larger gap, not a smaller gap.
Yeah, and Mr. Klain, to that point, I really think it's premature that, maybe we should be having discussions about when we reopen, but I think it is way too soon, with the lack of testing has been stated, to entertain reopening. We're just basically placing ourselves back in a position where we're going to have more people impacted in a negative way by this disease. What's your response to that?
Well, I think, Mr. Chairman, I think it's an excellent point. I think there's two things I'd say in response to that. The first is the White House plan for reopening, which I thought was too lax as it was, had the requirement that a place see 14 days of consecutive decrease in cases before it began the reopening process. The 13 states that have announced that they're going to reopen today or Monday, none of them meet that qualification. So if you thought the White House plan was too lax on this, we're 0 for 13 on compliance, even with that very, very lax standard. That's the first thing I'd say. The second thing is we need to understand that protecting public safety and the economy, they aren't two different things. They're the same thing. A governor can say, my state is open, but unless consumers feel safe patronizing businesses, what good will that do? Unless workers feel safe on the job, what good will that do? What good will it do to open a restaurant and have your customers get sick? Will they ever come back again? So we need to see these public safety things and the economic things as working hand in hand together. We are a consumer-led economy in the United States. The governors decide if something's open. The consumers decide if people will show up. And I think we need to do a lot more to make those consumers feel safe in terms of testing, tracing cases, protecting them, protecting workers, before really any of these conversations are a very meaningful conversation.
Thank you. I'll yield to Mr. Rose for a couple of questions.
Thank you, Chairman. Mr. Klain, I want to just get down to this issue of critical supplies. Because it strikes me that that's really where this begins and ends when it comes to the federal government's role. I agree. Look, states and cities should be running testing centers. States, cities, regional coalitions can really lead the way on opening up. But they're struggling right now for swabs. Here in the greatest country in the history of the world, we're struggling to get glorified Q-tips. Now, this doesn't happen when there's a surge in demand for energy, right? The oil market produces supply. So it begs the question, why is the private sector not meeting demand? I mean, there's incredible profit if you can make masks. There's incredible profit if you can make swabs. There's incredible profit if you can make other forms of PPE and reagents. And one reason that it strikes me that it may be, and if you agree with this, I'd like to know what we can do, is that much of this private sector is unwilling to make the fixed investments to expand their production capacity significantly because they do not know when this demand will go away. So how do we eliminate the risk for them? Because I think that they need to exponentially increase their production capacity, 5-fold, 10-fold, 50-fold, and they're not doing it. I haven't seen people not seize opportunities in my lifetime. I can't even envision it. They don't want to make money. I don't get it. So help me understand here what we can do.
Well, Congressman, I think you do get it. And I think your analysis is exactly right. If we want as a country, the people who make masks, who make the face shields, who make the other kinds of protective gear, to make more of them, they have to know that we are going to buy a large supply for a long time. And I think what they're fearful of is that there'll be changes in purchasing patterns. And the problem is, as you said, it's a lack of federal leadership. And here's why. You know, if you're there, you're running one of these factories, and the policy of the United States is each state should order for itself. Each hospital should order for itself. Each pizza parlor should order masks for its pizza makers themselves. If that's our policy, and these orders trickle in and they come in from different places, you just don't know how many orders they're going to be and how long they're going to be there, if something will change, so on and so forth. And so you've seen this reluctance of manufacturers to make the kinds of commitments you're talking about. I think you're spot on this. What's the solution? Okay, the solution is for the federal government to either use the Defense Production Act or some other tool to place very, very large orders for a very, very long time and to assure people that the demand will be there if they provide the supply. I've said before, Congressman, there are only two ways to respond to an epidemic. You overdo it or you underdo it. Trying to get it exactly right will never work, okay? Because if you wait till you know exactly how many masks you need to make your order, it's just too late. And I've been very candid about the fact that when we responded to Ebola in West Africa, we built some Ebola treatment units that were never used. We ordered some supplies that were never used. But we made a decision that the only way to be sure that what we might need would be there was to order everything that we could need and then to use it as it was used. And we saved a lot of lives that way. And I think one fault of the federal response I have is it's been way too reluctant. I think testing's a really good example of this. The federal government hasn't, I think, ordered as many of these swabs as we should have, in part because of the hope that a new, better test would be developed. And a new, better test may well be developed. I hope it is. I hope it is tomorrow. I hope it is the next day. But we don't know when that day will come. And until then, we should be ordering millions and tens of millions of these swabs. And if the worst thing that happens, Congressman, is we order a bunch of these swabs and then a new test comes along and we don't use them, I think the American people would understand that.
Yeah,
I think they would say you did the smart thing.
You then have an opportunity to build up your strategic stockpile again. So how long of a deal should we be making? Should we be going to 3M and saying we want to make a 3-year deal for X number of billion masks? When we actually look at the financials, how long of a deal do these companies need to start building massively more factories? And do we also need to provide them with no interest loans as well? What do we have to do? And take 3M, for example. What kind of deal do we have to give 3M for it to massively, massively scale up its production to meet our demand?
Yeah, Congressman, I think a purchasing agreement will be enough. I think these companies, by and large, I mean, every company is a little different, but I think certainly 3M has access to capital, wouldn't have trouble getting a loan to build a factory if it had a guaranteed order from the federal government at a fair price, not a gouged price, but a fair price for these masks. I do think it's a multi-year deal. We're going to need these masks for a long time. And as you alluded to before, sir, if we wind up with a lot of masks and for some reason we don't need them all, and I suspect we're going to, but if for some reason we didn't, then we just put them in the strategic stockpile reserve. We put them in other reserves. I also have to say, Congressman, one thing we need to focus on is obviously we're focused on America first. We're focused on protecting our people. But this is a global problem, and soon it will spread more widely in the developing world. And we're going to need to help those countries deal with it. And I know that sometimes is a fact people don't want to hear, but we're never going to be safe in this country until we extinguish this virus everywhere. And so I think if the worst case scenario, we buy too many masks, and again, I think that's an improbable scenario, but then, we're going to need to ship masks to other countries too. So I would make a long-term commitment to the manufacturers to buy these masks at a fair price over the long haul and stockpile them if we don't need them. But I think we're going to need them.
And to the best of your knowledge, and then I'll defer back to the chairman, what is the longest deal that this administration has made with any manufacturer of critical supplies?
Congressman, I don't know the answer to that question. I'll check and get back to you, but I don't think there have been any long-term deals made on any of these supplies. And the last thing I should say on this is we've been talking about supplies, understandably. We also need to talk about therapeutics and ultimately vaccines. Congress, more than a decade ago, set up a special agency to do long-term procurement for that, BARDA, as part of HHS. President Trump recently removed the head of that agency, or reassigned him, I should say, Dr. Bright. And we need to get that position filled quickly, because the same conversation you and I are just having now about swabs and masks, and your point is those things aren't really rocket science. Well, it may not be rocket science, but it's going to be complicated to produce drugs and vaccines.
Sure.
And it's the same kind of conversation about those things as well, sir.
Great, thank you.
Of course.
Thank you, Mr. Rose. And, to both of you gentlemen's point, I think it's going to be the new normal. I believe that there is not going to be an instance where there are ever going to be too many masks or PPEs in this country for the foreseeable future. So to get those large orders and have the confidence that for 3M to make them, I think the market is going to exist, moving on into the future. Mr. Klain, the last time you appeared before the committee, there were just 700 cases in the entire country, and now we have over 1 million. Can you give us your thoughts on what's happened in the last 7 weeks and what's gone right and what's gone wrong?
Thank you, Congressman. I would say that clearly what's happened in the last 7 weeks is a massive spread of this disease. And we discussed it that day in early March, how likely it was. And appearing with me before your subcommittee were experts, the state public health commissioner from a person from that office from the state of New Jersey and from the state of Mississippi. And what was scary that day was each of them talked about their testing capacity at that moment in the hundreds of tests. I think the state of New Jersey at the time could test like 700 people, and the state of Mississippi 500 people, what those experts testified to that day before your subcommittee. And so clearly, I think what the alarm that was going off that day in March was that we were not ready, and we were not proceeding to get ready for what was coming. And now it has come, and we are seeing it. And look, what I would say is in terms of where it goes from here, the most unhelpful thing in public discourse right now is this image of the epidemic as a parabola, like we used to see in high school geometry. It's kind of a smooth curve. It goes up smooth, it comes down smooth, it comes down as quickly as it goes up. That's the image we've seen on TV and in newspapers and so on and so forth. What I can tell you from experience is there's no epidemic in the history of the world that's a parabola. Never works that way. It goes up more quickly and comes down much more slowly. It goes up steeply and it comes down gradually. It explodes and it's very hard to extinguish. And so we shouldn't expect to see this go away. as quickly as it came. It will take longer and harder. And when it goes away, it doesn't go away. The other part of the parabola is it comes all the way down to that x-axis. That's not what's going to happen here. We're going to be facing this for months. And even if there are fewer cases in the summer, as I expect there will be, because we will get this under control somewhat, it won't be zero, and it will come back up. It's a series of hills, of ups and downs, of jagged shapes, of advances and retreats. And we have to have that kind of mindset about the tough, long fight we are in for.
So that almost would follow the pattern of the flu every year, where it spikes and goes basically dissipates over a period of time. And in terms of PPEs, I think medical providers are going to have to be prepared to anyone that comes into their office moving forward, preparing for the worst and wearing protective garb until they realize what the issue is with the person. Because God forbid you bring someone in and it's COVID, and then you've exposed yourself prior to protecting yourself. So I think there's really a new normal that we're going to see. And Mr. Klain, after your time serving in the Obama administration as the Ebola czar, you urged the administration to stand up the Pandemic Prevention and Response Office. In 2018, President Trump dismantled that office, unfortunately. Do you think that the office would have been helpful during this COVID-19 issue?
I do think having a team of experts inside the White House would have been helpful in two respects that did not happen here. First, I think they would have been much more forceful in raising the alarm in January and February, in December, in January and February, about the nature of this threat. I think it would have been elevated more quickly, brought to the attention of the senior people in the White House more quickly and more forcefully than it was. And we missed an opportunity there. The lights were flashing. The system was flashing red in January, and we did very little as a country to prepare. And those days that we lost can be measured in lives that we've lost since then. And so I think that's one thing. I think the second thing is we've now learned that there were a series of bureaucratic snafus along the way, particularly around testing, disputes between the FDA and the CDC about how to get testing kits stood up in this country, about what protocols to use, so on and so forth. And I think a strong coordinating office in the White House would have brought those agencies together and resolved those disputes. That's what White House policy coordinators do. They resolve disputes between the agencies. In the end, we rely on our agencies to get things done, but agencies fight, and people in agencies fight. They have different points of view, and someone has to be in charge of resolving those disputes, or else they fester and they go unresolved. And I think we saw that particularly on the testing front in January and February. So I think we would be better off in terms of preparedness, better off on testing if that office had been in place as it was in the late Obama administration and early Trump administration.
Thank you. And I'll yield to Mr. Rose.
Am I unmuted? Good. All right. Mr. Clay, it strikes me that there's two different groupings in the economy right now. You got the economies that it was important for us to put it into a coma because we could resuscitate it relatively quickly, even in a world where we were still practicing a new form of social distancing behavior. And then there is an element of the economy that if this is to continue, and it looks like it will, that we have got to start acting as if that element of the economy will not come back for quite some time. My question to you is twofold. One, do you think that we have to be more honest with the American people about what are some things that will not be happening until there's a vaccine? And is it thereby the responsibility of the government to step in and address what will assuredly be a long-term unemployment crisis that will be catalyzed by this new normal?
I think that's very well put, Congressman. I think that obviously there's some activities that when it's in the nearer future, when the incidence of the disease is down, when there are this consistent period of disease reduction, when we get testing up a little bit, or not more than a little bit, substantially, and get all these other things in place where people will be able to go back to work in offices, manufacturing lines, and places like that. And then we have to talk about things like restaurants and sports arenas and theaters and other places where this is going to have impact for the indefinite future. I mean, even in states that have talked about, let's take restaurants as an example. Everyone can relate to that. Even in states that are reopening, most of them are saying that restaurants have to reopen with 50% of the tables or a third of the tables or some restriction like that. Well, if you know anyone in the restaurant business, you know it's a very hard business with 100% of the tables. Even if every single table's filled on a Saturday night or lunchtime on a Tuesday, it's hard to make money in the restaurant business. If you take out half the tables, it's going to be very hard to make money in the restaurant business. And that means also, even if somehow a restaurant can survive at half the tables, needs probably half the waiters and half the cooks, and it orders half the potatoes and half the broccoli and whatever. We just go down the line here. And the point is, as you suggest, those kinds of businesses are going to see this overhang, not just for weeks, but for months. And
do you see that overhang continuing until there's a vaccine? I mean, it is.
I think in all likelihood, yes. I mean, maybe we will get to the place where there's a prophylactic pill or treatment. Maybe we'll get to the place where there's a therapeutic that can make this a very moderate thing. So I don't think vaccine is the only answer. But vaccine is certainly one answer, and some other kind of medical thing is another answer. I suppose it's also possible that we could get to the place where we had testing that was so rapid and ubiquitous, and the ability to contact trace people, that even without medical countermeasures, you could have an assurance that there are only a handful of cases in a particular state, and we're tracking them all. So I think you'd either need really vastly improved surveillance or some kind of medical countermeasure. And right now, we're far from both those things. I mean, we could have a huge breakthrough tomorrow or the next day or whatever. And I think one thing about all this conversation is we need a certain modesty and humility in this conversation because there's just a lot of unknowns. But I think it's possible there is a serious overhang on serious segments of the economy for a long time. And I think, as you suggested, we should be honest with people about that and make sure our policy solutions encompass that possibility.
And in your mind, I mean, this notion of a vaccine has been thrown around as something that people are, it's coming in 12 to 18 months. We've been trying to get a vaccine for HIV for 30 years, 40 years. So what is it that we can do? Because I don't want to be sitting in a similar conversation 18 months from now and say, man, I wish we had done that to get a vaccine quicker.
Yeah.
What is it that you think that we can do? And paint it for us as if money were not an option or were not an issue, because I seriously don't believe it is right now.
Yeah. So, Congressman, I'd say there's 3 stages on this to think about. The first is the scientific stage of making the breakthrough that we have a vaccine that's safe and effective. And it feels to me like about as much on that front as going on that can be going on. And science is science. It will find this answer when it finds it. There's some promising candidates already. There's a vaccine from Oxford that's in testing already in monkeys here in this country. It's starting to go to more of a broader clinical test. So I think that part, the scientific work on this is impressive and ongoing. I think the 2 parts I'd focus on as a policymaker is manufacture and distribution. Once there is a vaccine, how long will it take to make hundreds of millions of doses? Okay, Congressman Payne is from New Jersey. It's the home of some of the world's leading pharmaceutical companies. If they had plants that could make hundreds of millions of doses of a vaccine, those plants would not be sitting empty. mean, these companies don't build giant plants to make hundreds of millions of doses of vaccine and then do nothing with them. So the existing plants are making vaccines that save lives. Are we going to displace that vaccine manufacturer to make this vaccine? What are we doing to build new plants and think about that? And I think that's a really, I think that's a really important thing to think about and to begin to dialogue with the pharmaceutical industry. As I mentioned earlier, we have an agency in the government that's supposed to be managing this problem called BARDA. It has no head right now. We need to get them to it, right? Thinking about this manufacturing problem, right? That's the second phase. The third phase, Congressman, is distribution. That seems like it should be easy. Like, we have this vaccine, it gets made, everyone should get it. But we know it's a challenge to get vaccines in people's arms. We vaccinate children in this country. We have a lot of children in this country who don't go vaccinated. We use the schools to force it, so on and so forth. Now we're talking about vaccinating not just the children, but every adult. Where are they going to get the vaccine? Who's going to pay for the vaccine? Where is it going to, and how are you going to get compliance? And the last thing I'll say on this, Congressman, is, and I know this is a controversial and a difficult topic, but we're going to have people say the vaccine's unsafe. We live in a world where vaccine resistance is growing, where the internet, where social media stirs this up. We saw yesterday in Michigan, protesters in the Michigan State House holding signs saying that Bill Gates had invented the disease to sell vaccine to make money. That's where we are right now before there is even a vaccine. So we can imagine the kind of unrest and chaos that we're going to see when there is a vaccine, and we're trying to get 70%, 80% of the American public to agree to take that vaccine. So I think it's a really hard challenge. It's not too soon to start to think about that challenge.
All right, thank you. It's very helpful.
Thank you, Mr. Rose. The topic, we know that that the testing is the key to the return of any sense of normalcy for the nation. Would you speak to the importance of testing once again? I think it needs to be reiterated as many times as possible. What is the best way to tackle the testing shortages issue in America?
Well, I do believe that the best way to tackle the immediate testing shortage is for the president to invoke the Defense Production Act and place these kinds of long-term, massive national orders for the key supplies needed to run tests, for the key chemicals, the reagents needed to conduct the tests, and for all the little parts that are needed for the machines that process the tests, many of which are manufactured in different places. And these machines, if you start to run giant numbers of tests, will break down. We're going to need replacement parts and maintenance on those machines. Congressman, in your state, we've seen Governor Murphy show great leadership on the testing front, but he'll be the first one to tell you that everything he's done is bollocksed up by a lack of these test swabs. And as Congressman Rose said, kind of glorified Q-tips. I get this question all the time. How can it be that the greatest nation on the earth is ground to a halt because we don't have swabs? I mean, it just seems the most perplexing and vexing thing you can imagine, right? But all these things have to be made. They have to be made in huge numbers. And so I think the answer to the testing thing is a unified federal order under the Defense Production Act to get these things made. Now, look, President Trump's been reluctant to invoke the DPA, and I think some of his supporters have said it's like socialism or whatever, but he invoked it last week for the meat industry and said that he would use the Defense Production Act to require the meat industry to produce meat. Meat's certainly important, but testing is more important. And I would use the same authority he applied to the meatpacking industry for the production of the key elements of these COVID tests.
Yeah, I'm very concerned that with this whole thing, and I think based on some of the things you're saying, the point, if we're going to continue to play catch up with this, we got a bad start when we first discussed this, and there were only 700 cases, and we've just never caught up. I think that to Mr. Rose's point, in terms of companies in this country that can make a profit from going into this business, too much of this has been sent offshore and allowed to be manufactured in other countries because of profit. And so we're going to have to look at these different businesses that are vital to our health in this country, and have some type of incentive for companies to bring it back to the United States. So we make sure we're not at the behest of another country and another source in times of great need. What do you say to that, Mr. McLean?
Congressman, I agree that we've learned that a lot of these key products are outsourced. That's a particularly problem for the parts for these testing machines. Almost all of them are made overseas. And obviously, this is part of a supply chain. Just if we think about this as national defense, where you want your key elements of your supply chain in a secure place. And so certainly we need to insource more of this. But what I would say is that also we need to really build up our strategic stockpile in this regard, and we need to act quickly because I think right now placing orders with existing manufacturers is probably the best and quickest solution. But I agree, ultimately insourcing more of the manufacturing chain to our country is a long run strategy here.
Okay. Mr. Rose?
Yeah, Mr. Clay, what are you right now? What are your opinions on what Sweden's doing?
Well, I think it's really hard to assess any one of these countries from far away. What's gone right, what's gone wrong, and I really hesitate to bring judgment to one of these other countries without really being on the ground and not really seeing it. What I will say is that we know that countries in Asia, for example, which acted more quickly on social distancing and acted more quickly on testing, countries like Korea and Singapore, have had better results so far. Now we're starting to see some resurgence there as they let up on these social distancing measures. And we've seen very uneven actions in Europe. So far, at least on the numbers, it looks like Germany has done the best. But I think what's true, Congressman, is in all countries, in the end, it comes down to two things, given our current medical science and current technology, and that is testing and distancing. And that's really what it comes down to. I mean, we can either identify who has it and identify who's been in contact with them. That's the method of disease control we've used around the world for more than 100 years. It's how we fought tuberculosis 100 years ago. Test for it, trace the people who have it, isolate their contacts, or use quarantines and social distancing to try to keep people from mixing with one another. They are both kind of crude, simplistic instruments, but those are the tools the world has now. Now, we will someday get, presumably, a prophylactic pill, treatments, vaccines, all these things. But those really are, when you think about the strategy, those are the two tools you have to manage this disease.
Can you speak to some of the, as we look at contact tracing more and more, which will have to involve technology, what are some of the privacy dynamics that we're going to be encountering? What should we be doing? What should we be talking about? Because obviously people's public health has to come first. But I assure you, and you know this, you've experienced this, that there will be a whole nother contingent of folks who will be rising up saying, no, do not institute that piece of technology because it infringes upon rights X, Y, or Z.
Yeah.
How do we walk this line?
Well, I think that I think it's a good question to raise. And I think we need to start to talk to the American people candidly about the fact that some of these technological tools are going to be necessary to make them safe. And that, we're having a big debate in our country about communitarianism versus libertarianism. And it's a philosophical debate everyone had, at school at some point in time, and it's playing out in real time with real serious life and death consequences. And this is one of those things where we are going to need to find a way to use technological tools to help power contact tracing. And I think it is going to raise the concerns you raise. And I think, as you suggested before, Congressman, having an honest and candid dialogue with the American people is the very best we can do to prepare them for that. But I will say one other thing. I think perhaps there's too much hope for these technological tools. In the end, contact tracing is a human endeavor. Someone knows that my phone was near your phone. Okay, that's an interesting fact, but it's only a somewhat interesting fact. They want to know, did we actually shake hands? How close were we to one another? Did you happen to sneeze when I was around? And so I think it's unlikely, in my view, that these technological tools alone are going to solve it. We're going to need literally tens of thousands, if not hundreds of thousands of people
Sure.
to really make all this work.
You can understand as a New York City resident, though, how that scenario sounds difficult for me to see playing out. The second that you hop on the subway, I don't care how many contact tracers you employ. The second I get off the train or off the Staten Island ferry, I have no idea who sneezed around me and so on and so forth. So I do think that New York City's in a particular situation, and maybe 4 or 5 other cities in the United States of America. I want to just ask one last question
Yes, sir.
on the hospital beds front.
And we're going to have to wrap it up quickly.
How many more, if we want to, we should be taking advantage of this moment to prepare for the second surge.
Yeah.
How many more hospital beds do you think we should be building out in the United States of America? What kind of metrics should we be laying out here? And if there's anything I learned from recently deploying to stand up a COVID-only facility, that it's not just the bed, right? And we actually should stop using that term. It is the combination of the medical professional, the PPE, the ventilator, the bed, as well as the supply system attached to that, which you can only really have in a hospital system. So how many more of those do we need? And what should we be doing now? If we have a 90-day low or we're going down or this or that, what should we be doing that we're not doing?
Yeah, so great question. So I just say quickly, I think it's probably on the order of 100,000 treatment units. I agree with your point, absolutely. It's not just a bed. It's a bed, it's the equipment, it's the person that's working in front of that bed. It's all those things. And I think what's going to be most important, Congressman, is mobility. Because I think what we're going to see in the second wave are more of these spot outbreaks that are severe in places and different in places. And so I think the ability to have something like a mobile medical unit that can really move quickly to be deployed from place to place as this comes and goes in different places, I think is really going to be the critical thing. We used some of those tools in West Africa in fighting Ebola. We built a mobile hospital in Monrovia, thanks to the work of the U.S. Army and the U.S. Public Health Service, the Public Health Corps, the uniformed Public Health Corps. And we're going to need tools like that that can be rapidly deployed, because I think you'll see these flash outbreaks around the country where systems are at risk of breaking, and we're going to need to really do that. And the last thing I have to say, Congressman, is that we're also going to need to really permanently have a mindset of separate COVID wards in existing healthcare facilities. What I worry about is that we can't turn off a so-called elective surgery again. We can't turn off these other medical procedures. We're going to see deaths from heart attacks and cancers start to go up because of a lack of access to the healthcare. And yet, most of our hospitals, they need work on infection control and the risks of cross-contamination. So thinking about how to separate these patients, Congressman Payne alluded to before, doctors' offices. It's doubly true for hospitals, where you need to have people being able to get safe care for many things while they're treating COVID patients someplace else, separate teams, separate units, separate entrances, separate equipment. That's really, really critical. Our very best hospitals in America have that. Bellevue in New York City is an example of one of these superb special pathogen units, for example. We don't have many of those. We're going to need a lot more people, much more adept at that kind of work as we go forward.
Thank you. Thank you.
Thank you, sir.
Okay, well, Mr. Klain, we thank you again for taking the time to contribute to this important conversation. The committee always welcomes your expertise and appreciates your feedback. And with that, with your hard stop in 1 minute, I will close. Thank you so much for being with us this afternoon. And that concludes this WebEx. Thank you.
Thank you, sir. Thank you both.